products, and it is very severe. The patients who have this are admitted to the hospital. Many of them are winding up in the intensive care unit, and many of them are winding up on the ventilator with assisted ventilations until they can get through it. Some of those who survive this are winding up with, at this point, looks like some lung injury. Some of the earlier cases, it looks like that injury may heal over time. It's a little bit unclear, and some seem to respond fairly well, but it is definitely a lung injury. The other phenomenon is that this appears to be occurring predominantly in younger people. It's too early to say if there's a physiology difference between younger people and older people, or maybe that the younger people are vaping different substances, or there's some other reason why this is predominantly in younger people. We have seen it up into young adults and people in their 30s, but it is predominantly people in their teens and early 20s. So this is very serious. The CDC is working with the states to further refine what may be behind this, what's actually causing it. But the message I think for everyone to take home is that currently now something has changed about vaping. So before, for decades, from a public health standpoint, we've been warning people about the dangers of smoking tobacco. Vaping came along, and there was a comment made by those who were in support of vaping that it was a safer form of enjoying tobacco products. From a public health standpoint, we've never felt that way, nor do we feel that way today. And in fact, this new phenomenon only reinforces the fact that no one should be taking any sense of feeling secure that because I'm vaping, I'm not being exposed to the dangers of tobacco. Remember, in many of the vaping substances, the substrates that people are vaping, it's nicotine-based. And nicotine is an addictive drug, period. End of story. It is an addictive drug. One of the issues with vaping is that they have lots of flavors and this, that, and the other, and that is unfortunately very appealing to the younger folks. And we're seeing that as much as 20% of high school seniors report that they have experimented with vaping. In Texas, the law is now that in order to sell tobacco products, the person purchasing needs to be 21 years of age, and that includes vaping products. And there's very good reasons behind that. These are nicotine-based products, tobacco-based nicotine products are addictive drugs, and the consequences of breathing in the carcinogens and the other damaging effects from cigarette smoke lead to not only lung cancer years down the road, but also emphysema, hypertension, heart disease, stroke. There are all kinds of negative consequences from it. So this vaping situation is a little bit more concerning if we're seeing an increased number of young people becoming addicted to nicotine and then having to pay the consequences of that years on down the road. In addition, there is some concern about what it is that's in the vaping substances. You'll see the CDC is looking at basically two things. One is it there are places where people can purchase very often over the web or on street corners the vaping liquids that have THC in them, active component of marijuana. And there seems to be, in a lot of the cases, there's reports that the people who became ill were vaping THC-related products. So is it the THC? There is also, we're looking at, the scientists that are researching this, I should say, are looking at a vitamin E analog that is used in there. And vitamin E generally is not a problem. We've used it on our skin, it's in our food, it's generally a good substrate to have in your diet, but it is an oil-based substance, and perhaps that's not so good in your lungs, especially when it's at high heat. So we don't know. So there's a lot of unanswered questions about the science behind what's exactly causing this, but the bottom line is this is a real phenomenon. Parents, you need to look out for your kids, find out what they're doing, educate them that this is dangerous. Vaping is not cool. Cigarette smoking is not cool. And as a society, we need to stop making it look like it's cool because it's getting our children to engage in behaviors that could have serious medical consequences for them later on in life. And with that, I think I'll take questions. Yes?
From these three cases, what commonalities in them in the Houston area have you seen?
The commonalities of the three cases here is that they're all young people. And under the age of 21 is what I can tell you, but they're all young people. And that's one of the things that has me most concerned about this, is that this is a time in life when, during adolescence is when we experiment with things, where we try to be like adults and we kind of get a little bit ahead of ourselves and we start doing adult behaviors, whether it be driving too fast, smoking cigarettes, experimenting with alcohol. This is the age where we do those things, and it's natural that kids are going to go over the line there a little bit. We all did it. Everyone in the room did it. right? We all know this is what adolescents do. But it's the parents that have got to stay on top of these kids and try to keep them between the lanes.
Just to be clear though, these were nicotine vaping, they weren't cannabis vapes.
So due to privacy laws, I really can't give you a direct answer to that question. Yeah, but they were vaping. They were definitely vaping, but I can't tell you what they specifically were vaping because of the privacy laws.
What can you tell us about the 3 cases?
That they're all adolescents. They're all young people. They're all in their teens.
And was it do you know anything about the Tombaugh case from yesterday?
So all I know is what I saw that you all reported in the news last night, and I'm glad you bring that up because I don't think that's the same as what we're talking about, the vaping. So with this vaping, it's a lung injury that generally takes several days to progress, where they'll have symptoms of a cough, feeling short of breath, becoming fatigued, and then it gets worse to the point where the parents are bringing the kids to their doctor or to the hospital. So it takes a couple of days. What happened, according to what I saw in the news last night, was the young person took one breath off the vaping cigarette, the e-cigarette, and then collapsed. So that sounds very different. That is being investigated. That is a Harris County Public Health. They're on top of it. I spoke with them this morning. They're interviewing and getting the information, and they'll probably come out with something within the next day or so about that. But based on what I read, I don't think that's related to what I'm talking about today.
Doctor, would you recommend a ban on flavored e-cigarettes or e-cigarettes?
So from a public health standpoint, I think that any nicotine-based products, I mean, from public health, we think that all tobacco use, whether it be traditional cigarettes or vaping, is a hazard to people's health. And so people need to think long and hard. It's a free country. People get to make a decision for themselves. But from a public health standpoint, I would recommend that people not smoke. I don't smoke. I come from a family full of smokers. Both my parents and my brother died from the consequences of tobacco. So when you ask me that question, I think smoking is bad, period.
But no ban.
Well, that's not for me to decide. That's a question for those who make the laws in our society, and there's a lot that goes into that. From a public health standpoint, it is dangerous to your health. And it's on the side of every cigarette case. It's dangerous to your health.
Doctor, you briefly touched on this, on the signs and symptoms, but because this is a relatively new phenomenon, what should parents be looking for? What are some of those concerning symptoms that their teens or young people could be displaying?
Yeah, so the question is, what are the symptoms that parents should be looking for now? And every case is a little bit different, and it's early, so I'm going to talk in general terms. If you ask me that question 2 weeks from now, I may have a slightly different answer. But for now, shortness of breath for no apparent reason, shortness of breath at rest, a persistent cough for no good reason. It's not the cold or flu season right now, so we really shouldn't be a lot of people with productive coughs or even non-productive coughs. Fatigue. Increasing fatigue, again, generally while at rest, or fatiguing easily with the same amount of exertion that generally didn't. Walking up a flight of stairs should not make a teenager short of breath. So those are the sorts of things you should be watching for.
Are there any concerns for those around them that could also be exposed to the vapor?
The question is there anyone around them? So you're asking the question about secondhand smoke, and there's no evidence to support that yet. And with the age group that I'm worried about, I wouldn't be so much worried about the secondhand smoke as the secondhand behavior change. Bobby's doing it, Bobby's cool, now I want to do it. No, Bobby's not cool. Right? Bobby's making a big mistake. Don't think Bobby's cool, don't behave like Bobby.
I understand you said this is a new outbreak.
Hang on.
Would you liken the type of lung injury that you're seeing to anything else?
So no, this is new, this is unique. It's a little bit early to say. I guess I would liken it to, if I had to liken anything, it'd be likening it to inhaling some sort of a chemical exposure. And so, here we are in Houston, so we have experienced this. We have chemical releases every year, once or twice we have people who breathe in whatever got released, and they'll start complaining of pulmonary problems. So that's probably the closest thing that I could relate it to. The difference is that when we have a chemical release, generally the neighbors and the people nearby who do have problems, they have it pretty quickly. This seems to take several days. So in terms of it being an injury to the lung, it's similar that way, but the difference here is that it appears at this point that this takes a few days to progress, whereas your standard chemical release respiratory problems are pretty come on pretty rapidly. Sorry, somebody over here had a question.
Are the diagnoses and the prognosis the same for the 3 cases?
Yeah, well, I can tell you that they meet the case definition. We believe that it's all part of the same pathology. Now, I will also tell you that fortunately, all 3 kids are doing well and are improving. And we expect that they will have either complete or near complete recovery. So they're all doing well. Yes, sir.
Is the damage to their lungs the same thing that we're describing before, popcorn lung? Is that the same thing, or is it still something completely different?
So I would say it's different. I think it's going to be a little bit too early to say versus the popcorn lung. So this is a little bit early. I'm not going to go there. I just don't know enough yet.
Are the kids that are doing well and improving, are they still in the hospital, or are they out at this point?
So mixed. Some are still in the hospital, some are at home.
What would you tell a group of kids or some kids face to face about vaping? Should they vape? Should they not vape? How would you talk? What would you tell them to stop?
I would tell kids that vaping is dangerous in that you are breathing in an addictive drug. You're going to become addicted to that drug, the nicotine. And then you're going to have to worry about all the consequences for the rest of your life. It is so much easier to never start vaping or smoking than it is to quit. Mark Twain said, it's easy to quit smoking. I've done it dozens of times. And so, which means he really never quit, right? And so that's the thing. It's an addictive drug, and once you become addicted to it, it's very, very difficult to break from it. And here's another thing, and you know, I'm a little bit on my own. I'm not a smoker, but you know, smoking is not inexpensive, right? Cigarettes are expensive for a reason. There's lots of taxes on it. That's a disincentive to buying it. And so maybe we need to tax them more, perhaps. I don't know. Yes, sir.
Do you fear that number will increase due to the popularity of the product?
The cynic in me is concerned that it's going to increase, right? This is why we got to encourage the parents to get ahead of this. Adolescents are going to do what adolescents do, and if we don't get ahead of it, we don't try to educate our kids and guide them in the right way in their early life, then this will get worse. But we need to take care of our kids. You love your kids. Pay attention to them. Give them the good advice. If you smoke, tell them it's a bad habit that you have. Don't encourage them. Don't let them think that you're a role model if you smoke. And if you don't smoke, then be the role model and tell them. You know, it's harder to withstand that peer pressure and to say, no, I'm not going to. And if you want to be cool and you want to show strength, it's to say no. Yes, sir.
Doctor, it's just to,
This guy had his hand up.
Doctor, has the health department had any discussion either with the city, maybe the police department about looking into vape shops, policing them to make sure they're only selling to people who are of age and so on and so forth? Has there been any
Right.
discussion about that?
So as you know, that law just went into effect at the beginning of this month, and so the police department is routinely looking for sale of things to underage minors, even when it was 18, and so that continues. Now, in light of this, I don't know that we haven't had the conversation yet with the police department about stepping up efforts in the light of this, because this is so new, but that is a conversation that we maybe need to have. Yes, ma'am.
I'm going to ask you, Doctor, it's just
This guy, yeah, you have a.
cases as far as I know, so can you tell us how many are still in the hospital out of those three?
So I can't tell you because of the three, I don't know whether it's one or two is still in the hospital. It's either one or two are still in the hospital. The other one or two have gone home. I know that.
But if this takes a progression of a certain number of days to
Mhm.
develop, and there's the chance for more cases to come forward that people may be in the hospital in Houston right now?
Right. So you're asking the case. So you're asking the case. Are we missing any cases? Right.
Yes.
Right. And so we don't think that we are currently missing any cases because the healthcare industry, the medical professionals, the doctors, the nurses, we've been getting saturated with the information about this over the last month or so. So I don't think that we have any other current cases that we have missed, although everybody's looking. We're more concerned, were there cases 2 or 3 months ago that maybe were diagnosed as something else because people didn't know to look for it back then. And so we're doing that investigation now and seeing if we can identify any previous cases. But right now, pretty much every physician and nurse in the area knows that this is going on and are watching for it. So,
Doctor,
yeah.
Vaping isn't new, so
Right.
my question is, why is there still so many unanswered questions about
Yeah.
what could be causing something?
Yeah, excellent question. So vaping isn't new, but you're right. So something has changed, and that's what we're trying to figure out. So even the vaping with THC-based products is not new. That's been going on. So we don't know, but something clearly has changed in the last month to 6 weeks in the products that are being vaped, and that's what the CDC is working to find out. I don't have an answer. I'm not going to have it before they do.
And what about the lungs? Why is it impacting more teens and young adults versus an older person that's smoking the same thing?
Right, and so that was what we pointed out before, is that we're seeing this predominantly in young people. We've also seen it in people in their 20s and 30s, but it's predominantly people in their early 20s and in the teens. And so the question is there a difference in the physiology? Perhaps. That would be unlikely. As you know, the general rule of thumb is the younger you are, the more resilient you are, and the better your body is at defending itself. But perhaps there's some, residual immaturity of the immune system of the lung. And remember, these are not infections, but your immune system participates in the response that we're seeing. So even when you get a chemical exposure, it's your immune system that helps respond to that. So perhaps it has something to do with that, or perhaps there's something new in the vaping products, and that's what I think a lot of people are looking at. We don't have the answer to that question. That's one of the things that's so frustrating about this, that we just don't have that answer.
Here in the back, I wanted to ask, when you talk about the long-term ether to the lungs, how long is that, and what are the consequences in the long run of that?
So good question. He's asking about the long-term injury, and so I can't give you a great answer because we've only noticed this phenomenon over the last 6 weeks or so. So the folks that have recovered, and we've only had 3 cases here locally, so I'm getting this information from the cases that have occurred nationally, and what I'm reading about them is that some folks have recovered fairly quickly and appear to have no consequences at all. No, they were on a ventilator for several days and they survived that, but they seem to have had a complete recovery. There are other people that are still having some pulmonary problems, but it's only been 6-8 weeks at the most, and so how long we'll have to wait and see, unfortunately, because this is so new. We just can't answer that question. Hopefully everyone will have a complete recovery, but there are still some folks who experienced this phenomenon early that are continuing to have some respiratory problems that the doctors can measure and observe.
Existing cases, can you talk about how these cases are being treated? Like if there's anything that's helping them show improvement?
So they're being treated basically with lung support. So there are some medications we can give patients that to help reduce the inflammation of the lungs. Remember, this has been shown it is not an infection. So antibiotics appear to have no impact on this at all. So it's really soothing down the lungs while they're inflamed and keeping the patient ventilated properly until their body recovers on its own. There does not seem to be any antidote, any magic bullet to reverse this. It's supportive care, getting the patient through the critical period and letting their body heal itself.
Sir?
Yes, sir.
Do you
Yes, ma'am.
think the federal government's doing enough? There are 6 cases,
Oh.
6 people dead, 450 cases.
Yeah.
Should this be sold? Should these be sold?
Well, should this be so?
Yeah,
And
sold.
of course,
Sold.
sold. Oh, should it be sold? Should the stuff be sold? Well, again, that's
They're
like,
not doing enough, and should they be sold?
yeah. So I think the CDC is, because this is very early. Now the numbers have sprung up, but it's thanks to the CDC and their monitoring that connected the dots, that realized that something had changed and alerted all of us to start paying particular attention to this type of patient. So without their support, without their epidemiology efforts, we probably still wouldn't know about this. So I think the CDC has done a very good job in catching this early. This has only been going on for a number of weeks now. Now the number is high, but here we are, the 4th largest city in the nation. We've only got 3 cases, right? Now, had we not known to be looking for them, we may not have connected those 3 cases out of the hundreds and hundreds of people who go to the hospital every day, right? So I think that the federal government has done a good job, and we know that their scientists are looking to try and figure out what, is it something about about youth that puts people at more risk for it, or is it something in the vaping? We know that work is going on, so I think that they have done. And I think I already answered the other questions, that personally and from a public health standpoint, vaping is dangerous. Cigarette and nicotine product use is dangerous. Whether it becomes allowed or not, that's a question for the legislatures and the lawmakers to make. But from a public health standpoint, there's really no question that tobacco use and tobacco byproduct use is unhealthy.
You sound confident that this was caused by vaping. Do you know that?
So in these 3 cases, right, that's why we're here today, because we've now confirmed that in these 3 cases, they meet the case definition for this phenomenon that's going out. To your question, if this were an infection with a particular rare bacteria, we could culture it, then I could, that would be, but what we're at the point now is this meets the case definition that's being used nationally, that the CDC has agreed on to identify these cases. And, the flip side of what I just said is we also know that in these cases there was no infection involved, so.
Are there consistencies besides, I know you mentioned age, how long they had been using, what type of product it was?
Yeah, those are all the sort of things that are being looked at. We only have the 3 cases here locally, so that's really not enough cases to be able to answer those types. Those are excellent questions, but with our 3 cases, that's not enough to be able to draw any conclusions. With the 450 cases across the nation the CDC is looking at, there may be enough information, and they will let us know as soon as they can draw those conclusions. But those are exactly the right questions that need to be asked.
Doctor, so how we can call this maybe new epidemic? Like, what is the name that you use to call this?
Yeah, acute pulmonary injury from vaping.
It seems a very critical distinction, though, whether this were a nicotine product or cannabis, and because we don't know the names of the individuals, I understand what you said about being a privacy concern, but we're putting out a message today, and it would seem that's a critical component of information to let the public know.
No, and I agree with you. Again, to kind of go into what I just said, these 3 cases these 3 are such a small cohort that you can't really draw any conclusions from these 3. But when you look at across the nation, there does appear to be a lot of the young people that have been hospitalized do admit that they were using THC-based product. Not all of them. Now, perhaps they're not telling the entire truth, or perhaps they are being truthful and they didn't use any THC-based products. But clearly, THC is on the list of suspects that may be causing this. along with the vitamin E, and I'm sure that there are some other things. So these 3 cases locally, we can't draw, the number's too small, I can't really draw any conclusions. But when you look at the 450 across the nation, that's where you can start drawing some conclusions. And yes, THC does, it's prevalent enough that it's got our attention. Let me put it to you that way.
Doctor, on the rise in level of THC, could that be a factor in these cases?
The rise level of THC means states authorizing it?
Well, the rise of THC in marijuana products, it's been getting higher and higher as the years
Yeah,
go
well,
on.
so since we don't know that THC is the culprit, it's kind of hard to answer that question. But like anything else, whether it be salt in your diet or THC, how much you use, or alcohol, the more you consume something, the more likely it's going to become a problem. In fact, when I was in medical school, one of those light bulb moments was when a professor explained to us that anything can be a poison. Oxygen can be a poison. Water can be a poison. It just depends on the dose you take in. And so it's the same thing. Alcohol, for people who have 1-2 drinks a week, is not a problem. For the one who has 1-2 drinks an hour, 5 days, 7 days a week, it becomes a poison. So it's the same thing with the THC, right? So now THC in this state and THC are illegal, right? So you're not supposed to have them in the state of Texas. In those states where it's allowed, and from my colleagues that I talked to, they're seeing the same things. That people use it recreationally in lower doses, they don't seem to wind up in the ER. The people they see in the ER with THC-based problems are people who are consuming way more than is, they're eating too many THC-based gummy bears than the label on the gummy bear bag says you should eat, right? So it's all dose dependent. Yes, ma'am.
Talking about the dosages, in these 3 specific cases, are you able to comment at all about the quantity or the amount?
Yeah, no, I can't comment about these 3 cases, so sorry.
Are you
And
aware
and again, these 3 cases are too small to draw any conclusions, so.
Are you aware of any cases, of any other possible cases in surrounding counties like Galveston, Fort Bend, Montgomery?
Yeah, so we're working with the surrounding public health areas, and in fact with the state, across the state, to try to identify cases. And so that information is starting to percolate up, but it's out of my jurisdiction, so I really shouldn't comment on it. But I do know that everybody is looking at cases. Now, we're talking about the 3 that we have confirmed, and if other jurisdictions have confirmed cases, once they become confirmed, they will probably let you know.
Whether parents feel that their kids are bathing, do you recommend they get tested?
So there's nothing really to test. Remember, this is an injury to the lungs, so if you don't have any symptoms, there's nothing to test for, right? But they do need to keep a close eye on the children for those early signs of shortness of breath, cough, and easy fatigability, getting short of breath or fatigued with the amount of exertion that would not normally cause that.
What can parents do to help them if they're already addicted to them, or what can teens do also to help stop?
So now we're going to go off. Excellent question. So the question is, what can parents do for kids who they think may have already become addicted to nicotine? And there are all sorts of nicotine addiction programs that are out there. They're historically focused on, your older adult who's been smoking for 10, 20 years. But that doesn't mean, and the reality is actually if you try to stop smoking or stop using nicotine early on after you start, it's much easier to quit. Even if you become addicted, it's much easier to quit after 2 years than it is after 20 years. So now would be the time. If the parents think that their kids have already become addicted to nicotine products, now is the time to have those hard conversations with them and try to get them into therapy. And whether it be a pediatrician or the primary care physician, they have the resources to help get folks to the right people in the right places to work on that. But absolutely, to your point, if a parent thinks that it's their kid and they're already addicted, that is not a reason to give up. That is, do it now, because every year that passes, it becomes more difficult to break the addiction. Okay, folks, I think that's about all you've got time for, and appreciate you getting the word out. Oh, my full name? My name is Dr. David Persse. That's spelled P-E-R-S-S-E, and it's pronounced Persse, like you pick up and carry things in. And my title is Public Health Authority, City of Houston. Okay, thank you, everybody.
Thank you.
No, man. I just buy bigger shirts. I didn't realize. Just figured I'd buy a bigger shirt, you know, yeah.
I'm just disappearing.
Just, you know, life is taking its toll.